So you've decided to get the gastric band. I bet by now you're a little excited and maybe a little nervous, especially if you've never had surgery before. The following slides are to help you get through the process without a hitch. Now we'll talk a little bit about how the band works. It's basically like putting a belt on your stomach. We fill this little ring with saline. We can also take fluid out if we need to. This belt or ring creates a narrowing, which slows the rate of food traveling from your upper stomach pouch to below the band into your stomach. If you've done your homework, some of this may be old news, but the band basically works by artificially creating a small upper stomach and dividing the remaining lower stomach. We create this narrowing by adjusting your band. We add saline periodically. Not everyone needs to have a fill, and following with your healthcare provider, we can determine when it is appropriate to adjust your band. This is accomplished in the office in a simple procedure. We access the port, which is on your left lower abdomen, and add fluid when the time is right. One important thing to remember is that your band works optimally if you do not drink while you are eating solid foods. This may be a tough habit to break, but it's one that is necessary if you want to be successful. The band is placed laparoscopically. What this means is we use special instruments with small incisions, and we use a camera inserted into your abdomen to visualize what is going on. It's considered a minimally invasive procedure, and most patients are back to work within a week. It does, however, require general anesthesia. It's important to remember that the band is a tool. It can limit what you eat if you follow the rules. It can slow the passage of food and reduce your hunger. It is important, however, that you eat slowly. Put your fork or spoon down between every bite, and this will allow you to pace yourself, and it will allow your brain to realize when you have had enough food without overeating. Your amount of weight loss is dependent on your commitment and your motivation. But we are here to help you. So if you encounter any struggles post-op, please feel free to call and come in the office. WBI has a comprehensive program geared to get you safely through the surgical process. Our preoperative requirements include an informational seminar. After that, you get to meet your surgeon and discuss what is best for you. A Steps to Success class is given at the start of the process to give you tips on changes that you will need to make to be successful postoperatively. We include a dietary consult as well as a psychological evaluation, and we do pull in other specialists as needed. We want this process to go smoothly for you. Your surgical scheduler will set up your pre-admission appointment for you. You need to make arrangements to have some final lab work and testing done, and this is to be completed somewhere in the 7 to 28 days before your surgery is scheduled. These final little tests will be checks and balances to make sure that your lab work is in normal or acceptable ranges to make your surgery safe. You may hear from us if you have any abnormalities, for instance, with your electrolytes. Oftentimes, patients who are taking blood pressure medicine may experience drops in their potassium. If this is the case, you will receive a phone call and we will instruct you on how to correct this. Most patients need an EKG and a chest X-ray prior to surgery. All of this will be done on the same day, and once again, it needs to be done in the window 7 to 28 days before your procedure. At this appointment, please bring a list of current medications. This helps everyone be on the same page as far as what medications you are taking, so please include over-the-counter medications and any nutritional supplements. It is important that you stop all herbal products and appetite-suppressing products, as well as alcohol, 2 weeks prior to your procedure. Your surgeon will discuss stopping blood-thinning products with you, and these should be discontinued somewhere 5 to 10 days before your procedure, depending on the medication. This includes daily aspirin and non-steroidal anti-inflammatory drugs such as ibuprofen, Advil, Aleve. Other products which are prescription include Coumadin, warfarin, Plavix, and these all have different time frames when they need to be discontinued. Plavix, which reduces platelet count, must be stopped 10 days before your procedure to avoid excess bleeding on the day of surgery. Continue to take all other routine medications, such as antihypertensives, for your blood pressure, your diabetic medications, and especially antidepressants. Do not ever stop these medications suddenly, as you could experience adverse effects. Postoperatively, as you lose weight, oftentimes you can expect to change some of your daily medications. Please check with your primary care physician prior to discontinuing anything. It's a good idea prior to surgery to look at your pills and figure out which ones are larger than a Tic Tac and determine if they can be crushed or broken for easier post-op swallowing. It's important that you do not crush time-released pills or capsules. If you have questions on this, I would suggest asking your pharmacist for guidance. At your final pre-op appointment, you'll meet with your surgeon. You'll get to ask final questions, check your weight loss progress from your liquid diet, review current medications, and you will receive a prescription for post-op pain medication at this time. Please do not take this medication before surgery. It is intended for post-op use only. The staff at WBI will also e-prescribe medications to your pharmacy, so don't be surprised if when you go to drop off your pain medication prescription that there are other medications waiting for you. Be sure to stay well hydrated the day before your procedure. Remove any body piercings and jewelry that you may have on. Fingernail polish and nail art needs to come off, with the exception of clear polish. Pack a few items for the hospital. Don't bring anything of value. Take a shower with antimicrobial soap the evening before your procedure. Try and get a good night's sleep, and you really should be in bed by midnight. But midnight is the cutoff point for drinking fluids. The day of surgery, I will remind you, nothing to eat or drink before your procedure or it will be canceled. We want your stomach empty so that you don't risk aspirating while you're under anesthesia. Take another shower and put on clean, comfortable clothes before leaving for the hospital. Bring a list of your current medications. If you use CPAP or BiPAP for breathing, you need to bring that along. If you use an inhaler, go ahead and pack that, but leave all other home medications at home. Pack or wear a pair of comfortable non-slip shoes that you can walk in after surgery, and leave anything unnecessary at home. Don't bring your laptop and cell phone. It just is something else to keep track of at the hospital. Immediately pre-op, when you get to the hospital, you'll be given a bariatric size gown to put on. A nurse will start your IV. You'll get to meet your anesthesiologist, and if you have any concerns, feel free to discuss them at this time, especially if you're nervous. Let them know. They can give you some medication to help you relax. The anesthesiologist will go over a quick medical history. It's important to share if you have any respiratory problems such as asthma, any cardiac history, diabetes, kidney problems, that sort of thing. The staff will review your medications, and be sure to tell anyone you come in contact with if you have an allergy to any medication. This way, repeating that information will make sure that you are not inadvertently given something that you've had a bad experience with before. You'll get to see your surgeon in the pre-op waiting area. The band surgery is actually a very simple procedure. The time it takes to put a band on is about equal to doing a laparoscopic gallbladder surgery, and many patients go home within a few hours of the procedure. Have your family wait in the designated waiting area for the surgeon to come and talk with them after he is done with your procedure, and family can feel free to ask the staff for updates if they are getting anxious with the wait. When you wake up, the nurses in the recovery room will be asking you to evaluate your level of pain. They will use a number scale from 0 to 10. They want to know if you're hurting, and they want to keep you comfortable but not overly sedated. So be sure to communicate if you are feeling uncomfortable. You will also have medication available if you need to have something for nausea. Not everyone feels nauseous because the anesthesiologists are really good about pre-medicating for nausea due to the anesthetic. But if you are experiencing any queasiness, let the staff know because we would like to avoid any post-operative vomiting with your new band in place. And also be aware you will not have a catheter draining your bladder, so you will need to get up and walk around. Before you go into the OR, we put all patients in sequential compression devices before surgery, and you will be wearing those during your procedure as well as post-op. The basic reason for this is to reduce the chance of having post-operative blood clots form. These sequential compression devices, or SCDs as we call them, are filled with air to squeeze your legs gently, and this promotes a good venous flow of blood. We'll also give you some medication to thin your blood a little post-op to help reduce the chance of a clot forming. But the most important thing that you can do is to get up and walk after surgery. We get most patients out of bed 1 to 2 hours after their procedure, but keep in mind you will need someone to walk with you. The nurses at the hospital will explain how to use an incentive spirometer. This is to help promote good breathing after surgery. We want you to concentrate on taking nice deep breaths and filling your lungs with air to avoid any post-operative pneumonia or respiratory complications. You may want to think about splinting if you need to cough post-op, and this can be accomplished by holding a pillow or a folded blanket across your abdomen when you need to cough, sneeze, laugh. It'll just give a little gentle support in case you feel a little achy. Another tip that I will offer is to roll to your side when you want to get out of bed. This way you will be using your oblique muscles rather than the muscles that have been traumatized by surgery. You may just find it's easier to get out of bed this way for the first few days. It's important to keep moving after surgery to prevent blood clots, but another reason we want you up and out of bed is it helps wake up your intestines again. It helps break up the gas bubbles that you may experience after having your abdomen filled with air for the laparoscopic surgery. It helps prevent constipation, and it does really improve your recovery phase. So don't be a couch potato. Get up and move. When you are awake enough to stand, your surgeon may have you do an upper GI swallow study, which will allow us to evaluate the placement of the lap band and to look at the emptying from the pouch. Not all patients require an upper GI, so do ask your surgeon if that will be in your post-op plan. You will also have to give a couple of tubes of blood just to make sure everything's okay for you to go home. Your first meal in the hospital will be clear liquids. This will be sugar-free or no added sugar products. Low sodium broth is another option. You'll be given 2-ounce servings. Keep in mind you should not be having anything carbonated and you should not use a straw. Straws force you to swallow air, which can be uncomfortable for your pouch. And we also find that you have less control over the sip size. You want to make sure that you sip slowly. Your diet will be advanced when you are tolerating the clear liquids. So you've had your surgery, you've been up and walking, your pain is under control, it's time to go home. This is usually within 6 to 8 hours of your procedure. However, Medicare patients must stay 23 hours for observation, so it will be an overnight stay. You'll get some discharge paperwork from the nursing staff, and they will review our post-op orders. Be patient with yourself. You've just undergone a life-changing procedure. Don't overdo it in your first week at home. Allow for rest periods during the day. Listen to your body. Take it easy. No heavy lifting. This is not the time to clean out the garage for a garage sale. Make sure that you review your instruction sheet from your pre-admission package and the booklet given to you. There's a lot of helpful information in there, but we're going to touch upon the following subjects: pain control, wound care, activity progression, possible nausea and vomiting, bowel changes, and what to do about routine medications. You will be given a prescription at your pre-op appointment with your surgeon for a liquid pain medication. Be sure to get this filled before you leave the hospital. If you've not had surgery before, you may be surprised that you feel a little uncomfortable and achy. This will get better with time. Everyone has different pain tolerances. You may find that during the day you can take plain acetaminophen liquid or Tylenol for minimal pain and the liquid pain medication for nighttime use. Be aware that you should not be taking medications such as aspirin, ibuprofen, Advil, Aleve, naproxen sodium, and Celebrex. All of those are included in the non-steroidal anti-inflammatory drug category, and these can lead to post-operative bleeding. For wound care after surgery, you will be taking a shower 1 day post-op. It's okay to leave steri-strips on and the clear operative site dressings, but if you have Band-Aids on, they should be removed prior to showering. Remember to use a clean towel after each shower, and it's important that you do not soak in a bathtub or swim or use a hot tub until all of your incisions are completely healed. Do not put any ointments, lotions, alcohol, peroxide, etc. on your incisions. Please do not pull at the incisions, and you don't have to cover them unless you feel better about putting a Band-Aid over them after bathing. The air actually will help them heal quicker, and if you're not having any drainage, Band-Aids are unnecessary. Please be sure to report any ongoing bleeding. We don't expect bleeding to continue for more than a day or so. Some clear or slightly bloody drainage is normal from an incision, and this is usually in the first day or so. Please report any ongoing bleeding. It is important that you get up and walk frequently. It helps reduce the chance of a blood clot forming. It also does help improve your recovery. Be sure not to do any heavy lifting, so nothing more than 10 to 20 pounds. If you have small children around, have them climb into your lap so you can hold them, but avoid bending and picking small children up. Nausea and vomiting is not usually a long-term problem. Nausea related to anesthesia usually lasts approximately 1 day. Use an anti-nausea medication if needed. It's important to go slowly with your dietary advances, so do be sure to follow the guidelines in your spiral handbook. Take small sips of fluids, no straws or large gulps, because this can promote vomiting. If you drink too quickly, the fluid hits your pouch and it's an automatic reflux. Call the office if you have any persistent issues with nausea and vomiting. Many patients experience some changes in their bowel habits during the first couple of weeks after surgery. Diarrhea is quite common. However, having multiple watery stools is unusual. If this were to occur, I would want you to call the office for guidance. Some patients develop constipation. So what do? We know that anesthesia and pain medications can cause a slowing in the bowel. So you need to be active. Walk frequently, drink plenty of fluids, use a soluble fiber daily, and if you need to, take some milk of magnesia or Miralax. The goal is to have a bowel movement every 1 to 3 days. If you are having difficulties, call the office. We want to help. After surgery, you need to be aware of pill size. You should not be swallowing anything larger than a Tic Tac. So if you have big pills, check with your pharmacist and find out if they can be crushed or cut. And remember, after you have a band adjustment, you need to go back to the small size pills again because tightening that band will make it difficult for pills to pass through. One final word on non-steroidal anti-inflammatories. Avoid them. They can cause problems with band erosion, with ulcers, and with stomach upset. Be sure to plan for a ride home from the hospital. You will have been taking pain medication, so you cannot drive. And no driving while you're taking pain medication post-op that first week or so. It's a good idea to avoid heavy lifting for about 2 weeks. So that's no more than 10 to 20 pounds. And you can discuss your return to work and exercise plans with your physician at your post-op appointment. If you have any questions, feel free to call us. The best daytime phone number is 775-789-9180, and this will get you in touch with a clinical staff. Do not call your patient advocate with medical questions, please. After hours, we have an answering service, and that number is 775-323-7500, but this is reserved for emergency questions only. Please do not email the staff with medical questions because this can lead to a delay in getting an answer to you. Please call if you have any of the following concerns: an elevated temperature above 101.5, night sweats, unrelated to menopausal conditions, redness and warmth at your incisions, thick yellow or green discharge from any incision, continued bloody drainage, or increased or uncontrolled pain. Go to the ER if you have any of the following: sudden and unexplained shortness of breath, chest pain, leg pain and swelling, and usually it's just one-sided leg pain. You may even notice a red streaking going up your leg. This is concerning for a blood clot. If you have a feeling of doom, this requires immediate evaluation. Now we'll go over some possible experiences. And I want to stress the word possible. Not everyone experiences every one of these issues, but I feel if you are prepared, you'll know what to do and when to call. If you are having persistent pain in your stomach, you need to call. You need to come in and see a provider. It's usually something that will resolve with taking a proton pump inhibitor. Be aware, taking non-steroidal drugs can increase your risk for band erosion and stomach upset, as well as ulcers. So avoid these products. Please report any problems with reflux to your healthcare provider. Any new onset of stomach pain or nausea may be a sign of an ulcer. Usually, the use of a proton pump inhibitor such as Prevacid or omeprazole will eliminate this problem. Avoid taking any aspirin-containing products or non-steroidal anti-inflammatory drugs such as ibuprofen, Advil, Aleve. Any of those could potentially harm your stomach. Nausea and vomiting is not a long-term issue. Many patients may feel a little queasy during the first 24 hours after anesthesia. You have medication that has been prescribed for nausea should you need it. Further out from surgery, some patients experience a new onset of nausea. It may be due to a vitamin imbalance or another health problem, such as an unexpected pregnancy. So if you have a new onset of nausea, please contact Western Bariatric and we can help determine the cause of your nausea. After the initial post-op period, if you come down with flu symptoms, you should call for direction to manage this. We would like to avoid vomiting, which can put stress on your lap band. Band slips or prolapse occur infrequently, but they are a real concern. A slip is usually the result of repeated vomiting or repeated overeating. It stresses the band. So you do need to slow down with your eating and chew thoroughly to avoid this. A slip can also occur if you have a band erosion or blockage. So if you experience any problems with feeding, you need to call the office. The follow-up care is very important with your band. At 1 to 2 weeks post-op, you'll come in and see your surgeon, and there will not be a band adjustment at this time. It's too soon. We need to allow your body to heal after surgery. At about 4 to 6 weeks, when many patients are starting to experience return of hunger, you will receive your first in-office band adjustment. And per APEX study recommendations put out by the Lapband company, they suggest returning to the office every 4 to 6 weeks after until you are dialed in to the green zone where you feel satiety with small portions. After having a band adjustment, you will need to go back to a full liquid diet for a few days and advance to a soft diet for several days, then back to regular. This happens with every band adjustment, and it allows your body to adjust to the new amount of fluid in your lap band system. During follow-up visits, we look at what you're eating, what you're drinking, any medication changes. We look at your activity level. I may suggest having a repeat resting metabolic rate after surgery. We look at your weight loss progress and plateaus. Lab work is typically examined at the 6-month post-op time frame and yearly. However, with vitamin D deficiency, your provider may check your vitamin D levels every 3 months until you are in an optimal zone. Adjustments and post-op care will be something that you need to commit to for the rest of your life. We want to see you every 6 to 12 months, even if you are doing well. Please maintain contact with your primary care physician, the person who supported you to get you through surgery. That care provider will be the one to adjust your routine medications, and that person will be the one you call for any medically based problems. Western Bariatric is here for your surgical follow-up. Before we move on to talking about your post-op diet, I just want to go over a couple of things. The band is a tool. It is a very helpful tool, but you must commit to the lifestyle changes in order to make it work. It's not going to work on its own. Don't forget to celebrate the milestones that you may experience. You may have put off traveling because you were too big to get on an airplane with a seatbelt without extensions. You may have been unable to tie your shoes or walk up the stairs without getting short of breath. Life is going to change for you, but you must commit to the lifestyle changes, and we are here to help.
Now we're going to talk about what to eat and drink after surgery. When you come in to see your surgeon for your preoperative appointment, you'll receive a packet. And in that packet, you'll have a handbook that will have the diet progression in there. It's also a troubleshooting guide for you after surgery. Be sure to read this packet through several times before surgery and refer to it after surgery as well. One of the problems that can happen right after surgery is dehydration. The goal is to have you drinking 64 fluid ounces a day, but it might take you a while to get up to that. Your first few weeks out from surgery, work on getting 32 to 45 fluid ounces in a day. One of the best ways to check to make sure you're hydrated is when you go to the bathroom, just check your urine. Should be clear or pale yellow. If it's starting to get darker yellow, you need to start pushing those fluids. Remember, with this surgery, there's no beverages with your meals and to wait at least 30 minutes after you're done eating before you start drinking beverages again. Please remember not to use a straw. That straw is filled with air, and when you suck on the straw, you're going to fill your pouch with that air bubble, and it's uncomfortable. The other thing is stay away from the carbonation. Those are gas bubbles. They expand in that pouch, create pressure and discomfort. Fluids that you can have between meals other than water are anything that's a 0 to low-calorie, non-carbonated beverage. You can use broth, tea, coffee. One of the things you want to keep in mind is that if you're going to use sugar-free Jell-O, be sure to chew it. It sounds silly, but if you don't chew your Jell-O, it can get stuck trying to go through that band, and you'll have to wait for it to melt. A word about alcohol. Alcohol has a lot of calories in it, and if you're having wine every night with dinner, you're going to be drinking in calories that you could be consuming in food, and it'll probably slow down your rate of weight loss. Your first week out from the hospital, you're going to be on full liquids. You're probably not going to be too hungry because you're going to have swelling from the surgery. Keeping in mind your portion sizes may be 1/4 to 1/2 cup per meal. These are guidelines only. In your handbook, you've got more information about the full liquids and the amounts and the foods to have. Several things you can use. You can use a blenderized soup. We want to make sure that anything that you're consuming at this point is pouring off of a spoon with no lumps and bumps. We don't want to risk having anything getting stuck in that band that's going to want to cause you to retch or regurgitate to get it up. You can continue with your protein shakes. You can take yogurt and thin it down with some milk. And remember to drink lots of water. Your second week out from surgery, you're going to be on smooth foods or pureed foods. We need you to stay on this stage to let your pouch heal. We don't want you having any food that's going to get stuck in that band that's going to cause you to regurgitate or vomit. Remember, portion sizes are 1/2 to 3/4 cup per meal. You may be starting to experience some hunger at this stage, but it's important that you stay on this stage of the diet and watch those portion sizes. Foods in this stage of the diet are described as foods that have no lumps and bumps and sit there on your plate. There's some consistency like yogurt or pudding. Remember to chew. You're choosing your protein foods first at this point, and remember to start your chewable or liquid multivitamins at this time. The weeks 3 and 4 will finish out your first month from surgery, and this is on soft foods. And soft foods are described as anything that can be mashed with a fork. Any meats you're eating, you're going to be wanting to use ground meats, ground chicken, ground turkey, or ground beef. Fish is easily mashed. Portion sizes are 1/2 to 1 cup per meal. You may be hungry at this point, and you may say, I can eat more food than that. Just because you feel like you can eat more food than that doesn't mean that you should be eating more food than that. You do not want to overfill that pouch. Be sure to chew everything. One of the things that's a problem with the band is that you can have foods that get stuck in there, so remember to stay away from those fibrous foods, staying away from those chunks of red meat, fibrous fruits and vegetables, the stringy ones like celery strings, asparagus stalks, and staying away from the white flour products, white bread, white tortillas, rice, pasta. Those things tend to lump up in your pouch and will make you uncomfortable. Exercise or physical activity is critical for long-term success, and this is a part of changing your lifestyle. We all need to look for ways to move more just in our daily activities. The goals from the American Society of Metabolic and Bariatric Surgery is to be doing 150 minutes a week up to 300 minutes a week of cardio, plus the 2 to 3 days of strength training. The strength training is critical because you want to lose fat. You do not want to lose muscle mass. Everybody can do something, and everybody's got to do something. Remember, this is a lifestyle change. You're changing your eating habits and you're changing your exercise habits. Your first 90 days after surgery are called your global period, and all of your office visits are included in your surgical fees. If you want to make an appointment to come in and see me, just call scheduling and they'll put you on my schedule. You don't have to be having problems. If you just want to come in and go over your food record or what are you doing or make sure you're on track, this is fine. Remember to read the food labels. You want to watch out for the fat and sugar on the foods. If you don't have a food label, you can look up a lot of the foods online. Remember to choose your calories wisely. One of the things about the band is that you can eat a large variety of food, and some of those foods may be high calorie, so you want to make wise choices. Please weigh yourself once a week. It can be frustrating to be hopping on and off the scale every day, several times a day. Rate of weight loss with this surgery is 1 to 2 pounds a week, but you can consistently lose weight for up to 3 years. In your packets that you'll receive at your pre-op visit, you do have a restaurant card. Keep that with you when you go out to eat. You can use it to order off the senior menu or ask for reduced portion sizes. Our 10 important rules for long-term success and weight maintenance. Number 1, eat 5 to 6 times a day. You want to make sure you're eating often enough. Your portion sizes are smaller and you want to keep your blood sugar stable. This is eating about every 2.5 to 3 hours. Number 2, eating only at planned meal times. This is not grazing. Grazing is that nibbling business that goes on all day long and is a major cause of weight regain. Number 3, eating good quality foods. Eat your protein first, eat your fruits and vegetables second, and eat healthy whole grain carbs if you have room. Number 4, eat slowly. Chew, chew, chew. Nobody wants food stuck in their band. It's very uncomfortable. Take small bites the size of the end of your little finger and chew everything 20 to 30 times. It should take you 20 to 30 minutes to eat your meal. One of the things that happens is when you're taking this much time to eat your meal, your food can get cold and it can be unappealing. A suggestion is to get yourself a coffee cup warmer. You can plug it in, put your plate on it, and it'll keep your food hot while you're eating. Number 5, keeping your portion sizes small, 1 cup max. Every time you come in and you get a fill, your portion sizes will be a little bit smaller. Number 6, stop eating when you are no longer hungry. You do not want to be full. Full is too much food. Full is discomfort. Number 7, no beverages while you're eating. You can drink up until mealtime. Stop drinking while you're eating, and then wait 30 minutes after you're finished eating before you start drinking again. Number 8, make sure you're getting in 64 fluid ounces a day, low calorie, no carbonation between your meals. Number 9, getting in your physical activity every day. And number 10, remember to take your chewable or liquid multivitamin supplement daily. Thank you for choosing WBI. We wish you well on your weight loss surgery journey, and we look forward to working with you in your post-op years.